Good day, my friends. Today, my name is Dr. Hillel Mazansky, specializing in medical hypnosis, guided visualization or guided meditation, nutrition and exercise, my mantra being how to live a longer, happier, healthier life. Today, we're going to discuss something extremely important for females and for males, and that is how you can prevent breast and prostate cancer from developing. Before we begin with a health tip, there are a few aphorisms or sayings that are very apt to what I'm going to say. The first is, an ounce of prevention is better than a pound of cure. The second is, you are what you eat. The third is, let food be thy medicine, and medicine be thy food. And last but not least, take care of your body when you are young, and your body will take care of you when you are old. That is the important one. Take care of your body now when you're still young, and then your body will take care of you when you are old. Breast and prostate cancer in the United States are the two most common forms of cancer, and the incidence of which is increasing and increasing all the time. I'm not going to go into all the reasons why, but suffice it to say that both breast and prostate cancer have a genetic component to it. Females have the BRCA gene, BRCA1 and BRCA2, and the males have the prostate gene, which is usually inherited from their fathers, uncles, or grandfathers. Now, studies have shown that you have two sisters who are twins, two brothers who are twins. Why does the one sister develop breast cancer, and why does the other brother why does the brother of the twin develop prostate cancer? The reason is simple. It is stress. The one is stressed, and that turns on or activates the gene. The stress is usually chronic and ongoing. Sometimes the patients are aware of the stress. Other times they suffer guilt, anxiety, depression, or something painful happened in their childhood they do not remember, and that fact is repressed in their memories because it was so painful for them. While using deep hypnosis, we are able to elicit the stress factor, because I'm of the belief that you don't treat the disease. You have to start at the core basic problem, which is stress. My second mantra is, the mind causes all one's physical and psychological ailments. If the mind causes it, which it does, the mind helps treat or heal it using medical hypnosis, guided imagery, nutrition and exercise, how to live a longer, happier, healthier life. And that's what we're going to discuss today. Now we'll get to the nitty-gritty of prevention. First of all, if you don't get into the sun very often, 5,000 units of vitamin D3 every day after your main meal. For those who are 40 and over, they can bask in the sun the whole day, but the older the skin gets, the less it absorbs of UVA and UVB light, which then converts to vitamin D3 or vitamin D. Vitamin D is also known as the sunshine vitamin, and I am extremely passionate about using vitamin D for cancer prevention, cancer treatment, and more. As most of you know, I live in San Diego, California, and researchers out of the University of California, San Diego, found that the bare minimum of vitamin D intake should be 5,000 units of D3, and if the disease is present, 10,000 units of vitamin D3. But I request, and I underline this, that start on your vitamin D3 5,000, and then after 3 months, have your healthcare provider do a blood level. Because oftentimes, the vitamin D is still low. I'm a case in point, although you can see I'm pretty tan, but the senior skin does not absorb the vitamin D. Now, your physician or your healthcare provider might say to you it's normal. Find out the exact number, because normal can be anything from 30 to 90. 30 is at the low end, about 90 to 100 is the upper end. Well, for cancer protection, you need to be slap bang in the middle between 45 and 50. If you are higher, that's fine, just continue. If you are lower, that's when you need to escalate it up. And traditional allopathic physicians, all they'll tell you is vitamin D is toxic, my friends. I have never, ever seen a case of toxicity. But what is toxic is the medication that physicians prescribe to their patients that have severe toxic side effects that lead to death. And the FDA has approved these drugs, resulting later on in the drug being withdrawn. Those physicians who tell you vitamin D is toxic, they don't know about vitamin D, and they have never ever seen a toxic dose of vitamin D. And it's vitamin D3, the active compound that you should take once a day after your main meal. The second thing to prevent breast and prostate cancer is to drink 4 or 5 cups of green tea every day. It may be caffeinated or decaffeinated, whatever you choose. Studies have shown that have been done in combination with prostate and breast cancer. United States and Japan did these studies because Japanese men and women never need mammograms or the male pap test to check for prostate cancer. They never get breast or prostate cancer. So they wanted to look into this, the reason being why. Well, Japanese have a lot of green tea, and they also eat soy all the time. So was the protective factor the green tea, or was it the soy? Studies proved through nutritional studies and complicated mathematical formulations that the soy was excluded, and it was the green tea that protected it. Now, how is that? Not bad. To drink green tea, take vitamin D3, and the last one is to eat 2 to 3 heaping tablespoons of ground organic flax seeds once or twice a day over your cereal, over your salad, if you do a smoothie, whatever. Take that because it has omega-3 fatty acids, which are far more beneficial than taking the omega-3 capsules. As far as females are concerned, limit your alcoholic beverage intake to 2 a week. 2 drinks a week, preferably red wine because of the health benefits of red wine. But also, if there is a family history in your family of breast cancer, limit your alcoholic intake to once a week only. Men, to help prevent prostate cancer, avoid all types of saturated fat, from meat and coconut oils and vegetable oils, all that, especially the meat, eating the skin of the chicken, all that is saturated fat. Cheese is another example. Avoid all those that contain saturated fat, and will help prevent prostate cancer. Exercise is extremely important in prevention of breast, prostate, and other types of cancers. If you go to a gym and do cardio, that's fine. But if you don't do exercise, all you need to do is to walk. Start off slowly, but increase your walking to about 30 to 45 minutes every day. And that is more than enough, which will help prevent you developing both of these diseases. If, however, the disease has begun, then we ask you to go to our website, drmedicalhypnosis.com, drmedicalhypnosis.com, and there you will see a cancer video, and you become empowered to assist yourself in the treatment of your breast and prostate cancer and other cancers. Nutrition and exercise is also included in every one of those videos. You might not need it, but maybe a loved one will. drmedicalhypnosis.com for all those of you who don't live in San Diego or Los Angeles, in that draining area. What I see in my office, the different diagnoses, what I see in the office, and according to the sales on drmedicalhypnosis.com, cancer is the most prevalent reason for consultation or purchase of the video. The next is stress, weight loss, migraine headaches, insomnia, fibromyalgia, and then all the rest come. There are 26 different videos that you can look at and see. Not that you need it, but if you do, it's available. But maybe your loved one will. Try and prevent breast and prostate cancer as much as you can, for you will then make a huge dent in your chances of not developing either two of the diseases. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.